Return on investment, return on investment. All the videos are talking about that. All the books talk about that. For every $1 you invest in training, you get $2 in savings. Now let me go into the data, more data about that. Okay, so here's some more data to support the return on investments. One study showed that 94% of employees will stay with the company longer and be more dedicated to the company if they get proper onboarding training. Also, you have to listen to them and see what their needs are. With this onboarding training, there's increased productivity and efficiency. A study found that 10% increase in employee training resulted in an 8.6% increase in productivity. Yay! This training reduced errors and waste. That's so important in your training. It can minimize workplace accidents. It can reduce healthcare costs for the employee, because if they have a back injury, they have to go to the doctor, it's more cost, and then your insurance plan gets raised. And also saves legal expenses. There's enhanced customer satisfaction. When your employees are trained, they treat the customer better. There was one study that showed that proper onboarding training resulted in the 218% higher income of the company per employee, and the profits increased 24%. Wow, money talks. Studies have shown a positive return on investments. And the Accenture study showed that for every $1 you invest in training, you have $3 that you save, and that's a return on investment of 353%. Yay! So the overall message is train your employees well. Show them your vision of your company. That will increase profits, increase client satisfaction, and give you less headaches. You can do it. Come to my training. So in summary, train now or pay for your mistakes later. Onboarding training will save you money. Also, you need to plan for acute stress. What do you do when you have acute stress? The patient falls, the patient gets angry. You can do things like stretching, taking deep breaths, eating a healthy snack, taking a 5-minute break. The caregiver should receive training before interacting with the patients. Inability to know how to lift and how to calm down the patient can give the caregiver quite a bit of stress. The boss needs to be very supportive and attentive to this and give the proper training. The caregiver needs to be aware of their emotional state. Are they happy, sad, anxious, scared, alone, lonely? When the patient does something unusual, personal emotional awareness and mental health training is important also. Stress management improves organizational health. Dr. Mashlock, an expert in work burnout, argues that managing stress is not about individual well-being. It's about the health of the whole company client system. Remember, caring for Alzheimer's patients is not just a physical job. It's an emotional and mental one also. And for your caregivers who aren't supported in their mental health, they risk burnout, stress, and even walking away from a job they love. Let's break this into